Good morning and thank you for joining us again. Teresa is not here for the YouTube session. I will now report our daily case counts. We now have a total of 12,816 cases to date. This is an increase of 32 cases from yesterday. Of the 32 new cases, 5 are outbreak related, 7 are community acquired, 10 are close contact of confirmed cases, and 10 cases are still being under investigated. 263 cases are active and 12,177 cases have resolved. Unfortunately, we are reporting 3 additional deaths related to COVID, which has now increased our case count, death counts of 376 that are related to COVID. I want to express my sincere condolences to the family who lost their loved ones. Of the 3 new deaths, 2 deaths are from the community, a man in his 70s and a woman in her 90s. 1 death is from the long-term care home, a woman in her 90s. Right now, there are 42 cases that are hospitalized and 7 are in the ICU. There are 12 active outbreaks in the region, 4 in the long-term care home and retirement home, 4 in the workplaces, 2 hospital outbreaks, 2 community outbreaks. With vaccine, we have a total of 24,519 doses have been administered in the Windsor-Essex region, with 11,491 people receiving both doses of vaccine and 1,537 people received only the first dose of the vaccine. On February 9th, the Provincial COVID-19 Vaccine Distribution Task Force released their guidance on prioritizing healthcare workers for COVID-19 vaccine. Based on the provincial direction, healthcare workers in the very high priority group are now eligible to receive their COVID vaccine. The Windsor-Essex County Health Unit has developed an online pre-registration form to gather insight into the healthcare sectors and settings in the Windsor-Essex County region that have employees that qualify for vaccination. Specifically, this process will be used to gather information about those that qualify for vaccination from healthcare organizations that provide frontline services. This process will ensure that the COVID-19 vaccine is administered to healthcare workers in the very high risk group. The Windsor-Essex County Health Unit will use the data collected from the registration platform to send a more detailed survey to verified healthcare sectors and settings partners to assess the organization's healthcare workers' risk level per provincial guidance and collect information to administer the COVID-19 vaccine for that workplace. The very high priority group includes frontline healthcare workers in the following sectors and settings: all remaining patient care areas in acute care and other hospital settings, congregate settings, including assisted living, correctional settings, residential facilities, hospices, palliative care settings, shelters, supportive housing outside of highest priority level, community care with high risk of exposure and serving specialized populations such as community health centers, home and community care, adult day programs for seniors. Other healthcare services for Indigenous population, community agencies with patient-facing providers delivering any type of health services to First Nation communities and Indigenous people that are not captured in any other previous vaccination program. Community care with high risk of exposure and serving the general population, such as in birth centers, community-based specialists, death investigation professionals, dentistry, gynecology, obstetrics, midwifery, nurse practitioner-led clinics, contract nursing agencies, ENT specialists, pharmacies, primary care, respirologists, respiratory therapy, walk-in clinics, and laboratory services. The Windsor and Essex County's COVID-19 vaccine prioritization plan was developed based on Ontario's priority directives to create a plan that will meet both the provincial priority mandates and prepare for ongoing rollout. The Windsor-Essex County Prioritization Committee developed this process of consultation with the healthcare sectors and settings to promote effective harm reduction and ensure community engagement and protect public trust. At this time, this prioritization assessment form is only eligible for organization that provides direct healthcare services. All submissions for consideration must be provided by an individual with signing authority from the organization. Only one request form will be permitted per organization, and only organization with healthcare workers in the highest and very high priority will be considered for vaccination at this time until the vaccine supply becomes more available. Please note that the Windsor-Essex County Health Unit does reserve the right to adjust the organizational risk assessment as needed for consistency across sectors. The online registration form will be live later today and will stay online throughout the month of February. It can also be accessed from the COVID-19 vaccines webpage. Thank you.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Good morning, doctor. So to be clear, you do not want every individual who works in a healthcare setting, congregate living setting to fill out this form. You want one person from the organizations representing that organization completing it.
That is correct, yes.
And you mentioned this is sort of for like organizational purposes. So is this signing up for the vaccine, or is this helping the health unit see who is out there that needs one?
No, this is for the healthcare workers to get the vaccine. There are a number of very high priority healthcare workers identified in the provincial guidance document that qualifies to receive a vaccine. So all these healthcare agencies, organizations working in Windsor-Essex, they will now have the ability to register their organization for all their frontline healthcare workers and to get them registered to receive the vaccine in a timely manner. Recognizing that this is a large group and it will take some time before everyone is vaccinated, but we wanted to open up this process so people start to register and get the vaccine as soon as possible, pending the supply of the vaccine in the region.
Do you have a sense of when the vaccination for this group will begin?
Well, we are anticipating that when we start collecting that information, they should be able to start receiving the vaccine as early as next week.
Okay, thank you.
Any questions from AMA 100?
Dr. Ahmed, you mentioned this is a large group. An estimation, how many individuals are you looking at here?
Well, our initial estimate, including all the healthcare workers in the region, was close to 11,000, and that number has gone down substantially with majority of the hospitals and the long-term care home, retirement home workers vaccinated. So we are anticipating still at least close to 5,000 or 6,000 healthcare workers at this time. But again, those are all estimates. When we have the data collected, we'll have a better sense of what number we are looking at.
In this, for these workers, they can still turn it down if they don't feel comfortable getting the vaccine?
Well, vaccine is available for anyone who wants the vaccine, and so the organizations who are completing those forms, they will obviously identify individuals who are interested in getting the vaccine to make sure that we're not chasing people who don't want the vaccine at this time. We'll provide the vaccine for who wants it and in a timely manner.
I know before when treatment prevention, there was some individuals at the long-term care and I believe at the hospitals you mentioned turned it down. If they have a change of heart, where do they fall into the list? Just say they have a change of heart and they want the vaccine now. Where do they fall on the list?
Well, it depends on the priority that we are working on, and of course, if they are working in a high-risk environment, the ability to get them vaccinated would be higher. But again, when we start to see these appointments getting booked, we don't want to bump anyone to accommodate someone who has change of heart. So I think they can get back onto the list, but they'll have to follow what the current schedule and the availability of vaccine looks like.
Thank you.
Any questions from CTV?
Yes, good morning. You've mentioned several times before that deaths are a lagging indicator, but are you surprised to still see deaths almost daily, given that the case count has been low for several weeks now?
Yeah, it's that's why we are seeing that even when we're talking about the deaths in the community, and as even today I reported 3 deaths, and 2 deaths are in the community and 1 in the long-term care home. The good thing is we have vaccinated more than 90% of the residents in the long-term care home. And but when we are talking about the community, we are still haven't vaccinated them, and that's a large group. And as we reported yesterday, there's work happening to start vaccinating these 80+ population. And again, we're hoping to start their vaccination as soon as possible too, to give them the level of protection. But I agree that the deaths are still is a concern, and that's why my real push in the region is to get the 80+ vaccinated as soon as possible.
Thank you.
Any questions from CBC?
Hi, good morning, Dr. Ahmed. I'm wondering if there's any update regarding the outbreak at the downtown mission and the move to the aquatic center. I'm wondering how that transition is going, and also if you can provide any update about the number of cases associated with the outbreak.
So last I am aware that I haven't seen any specific, any new cases from the downtown mission since yesterday. Yesterday our total case count was 70, included the staff and workers. And there are obviously some testing happened yesterday too. I haven't seen the results yet. And the transition from the city's opening up the temporary shelter, that work is happening, and we're anticipating that it would be functional soon. I don't have a timeline. The city is working on it, but we want to get it up and running as soon as possible to ensure that we are providing the same level of protection and care to our most vulnerable population in the community.
There seemed to be a bit of a scramble to deal with that outbreak. I'm wondering why there wasn't a contingency plan in place for a shelter outbreak sooner.
Well, I think it's a good question. We have been in conversation with all our health system partners as well. Every shelters, every congregate setting, they have to have their own plans in place to deal with this outbreak, and also as the overall plan, when we recognize that this is a difficult population, there are limited opportunities to provide to put the control measures that we need to have in place for this population. Ensuring all these physical distancing, ensuring that they are wearing the mask appropriately, they're following the direction, that's challenging. I won't necessarily say that there was this there was no plan, but I think the plan was not as defined and not on detail. And as a public health unit, obviously don't have the plan for the agencies. The agencies have to have their own plan. We provide them with the expertise and the support, and then the other supporting agencies, they also have limited roles in various ways to support the plans for each of these congregate settings.
Thank you very much.
Any questions from Blackburn?
Yes, good morning. Dr. Ahmed, you just mentioned that, the deaths are still happening, and, the greatest risk is within that 80+ community. I know the province has said that they are now allowed in that phase 1. So what are the factors here that are kind of maybe not delaying, maybe not the right word, but what are the challenges now rolling out the vaccine to that population?
Well, I think the critical piece is, again, the sequencing, that how the province wants to sequence all of these priorities, and recognizing that our region is still way ahead of many regions when it comes to the vaccination and the priorities that we are touching. The key piece or the difference with the providing the vaccine to these groups versus the seniors in the community. And I think Taylor asked this question, or Rob asked this question, I forgot. But basically that we're expecting these agencies to complete the survey. So in return, what we are anticipating that there may be, I don't know, 400, 300 agencies who will complete that survey. But when you're talking about the seniors in the community, we're talking about one individual or two individual per survey for a household, which could be thousands and thousands of people that we would be registering. So we wanted to make sure that we have a system in place. The province hasn't put a system yet. So our team has been scrambling to make sure that we have a system in place to get information, to collect all that information from all these eligible seniors, and then also to provide the equity-based approach. So not everyone will have access to internet or to go online and register themselves. We also wanted to make sure that we have to have some kind of a call-in center in place to get to provide that opportunity for seniors to register. And then once they register, the other part is we want to make sure that we are not putting these 80+ people at risk. And if you recall our mass vaccine rollout plan, we initially wanted all these people to go to their primary care provider to get their vaccine. Same idea, that the system, that the province hasn't provided that system yet to the primary care provider to start vaccinating this population, and then the additional challenges with the availability of the vaccine. So we need another targeted clinic that we can use to vaccinate our seniors in the community. Having the same site that's accessed by a healthcare provider who may have a risk of exposure to a high-risk population, 80+, not a good idea. So we want to separate them out. And for that reason, we needed a site that can be catered, that can cater only to the seniors 80+, without putting them in any additional risk of coming in close contact with healthcare worker or anyone else who might have exposed. So those are the logistical challenges that we had, but fortunately, we are working very closely with our city and our county partners, also with our healthcare system partners, to have all of those things in place. And as we indicated, you may hear, just like I announced the healthcare worker, the very high priority healthcare worker vaccination rollout plan, you will hear maybe in the next day or two about how all these seniors 80+ will start registering and start to get vaccine in a timely manner.
Thank you.
Any additional questions from the Windsor Star?
Yes, I asked this yesterday, Doctor, but do you have an update on how steady the supply of vaccines will be in the region, and how many we might expect to get on a regular basis?
So we got another confirmation of our vaccine supply for the second week of March, and it seems like our vaccine supply has been steady. It is not increasing. So up until March 15th, or the second week of March, we will have the same vaccine supply as we are seeing for the for some time. We anticipate that after mid-March or early April, that's when we will start to see more vaccine coming out to the region. So that's the hope, but we want to make sure that at least we are trying to maximize the opportunity to roll out the vaccine to the right people in a timely manner. So we are hoping that eventually we'll get more vaccine. We have got good systems in place, and the only rate limiting step is the availability of the vaccine at this time. And once we start to have some of the additional system in place for the 80+ population and we start vaccinating them, we can continue on with the age-based criteria as well as any other prioritization and sequencing criteria that the province will define.
I expect the health unit will no longer be receiving the Moderna vaccine. Does that mean we will be getting twice as much Pfizer, some to the health unit, some to Windsor Regional Hospital?
So that's a question that I don't have an answer yet. Nobody has informed that we will not get the Moderna vaccine. We know that the government of Canada has ordered more Pfizer vaccine than the Moderna. And with the challenges of storing it at ultra cold temperature, Pfizer vaccine is not as user-friendly, if you want to call it, especially to use in the remote communities. So most of these Moderna vaccine are mobilized into remote communities to give them the vaccination opportunities. Fortunately for us, we have ultra cold vaccine freezers at the health unit. We have ultra cold vaccine freezers with Windsor Regional Hospital. So between the two of us, we do have the capacity to even administer Pfizer vaccine. And so hoping that, we will have a little bit more flexibility with additional vaccine. We're thinking about talking about AstraZeneca that should be approved shortly, and then we'll have 3 vaccine, and hopefully in the future we get other type of vaccine available to us that we can continue to roll out. We don't know how the allocation will change. If the province decide that they don't want to send any Moderna to us, that's fine too. But we want to make sure that we have enough vaccine for Pfizer to continue to vaccinate our population. There's another provincial group that is looking at the vaccine allocation to the region, and there's been some discussion that how that allocation should happen. Should it just be based primarily on the population base, or should it be based on the priority population, just like it started, because Windsor-Essex and some of the other gray lockdown region were hardest hit, and they were prioritized to receive the vaccine first. So there's a number of conversation happening at different levels. From our end, we just need the vaccine. We want the vaccine to come quickly to us, and we have the ability, we have the setup now ready, even though the provincial setup is not ready, but we have our setup ready to start mobilizing, start rolling out the vaccine as quickly as possible.
Thank you.
Any additional questions from AM 800?
Dr. Ahmed, with the additional healthcare workers, would it be the health unit nurses administering the vaccine, or is it going to be a tag team approach with Windsor Regional at St. Clair?
So you're asking a question that I wanted to answer maybe in the next couple of days, but so what would happen is we are hoping that all these healthcare worker will continue to go to the St. Clair College site, and then we are working on another site for the 80+ population. So anyone who's going to the St. Clair site, they will continue to get the vaccine through the staff that are working at the clinic, which are generally the hospital staff and other support that they have. With our targeted clinic that would be set up shortly, that would be staffed by our health unit nurses, and in collaboration with the additional staff that we need from our supporting agencies, mainly the city or the county.
And then one final one here, switching gears. I was reading yesterday, the medical officer of health in London was talking about their zone status. Right now they're in red, but with their numbers, he thinks they can go down to yellow next week. With our current numbers, 25 on Sunday, 13 yesterday, and 32 today, are we, I don't have the list in front of me here, but are we on track to go into orange zone if, when I guess the province reaches out to you?
I don't know how these numbers add up from a weekly case rate perspective. So what I remember last Friday when we reported 58.1 cases per 100,000 population, and the criteria to go in orange needs to be less than 40 cases per 100,000 population per week. So we'll have to take a look at the number, and as indicated earlier, I think we also the province will also look into whether this is a trend or if this is just a one-off that our numbers are down. So typically and historically, what they have done is they looked at 2 weeks worth of data before switching any region into I guess a lower restriction level.
Has there been any indication that they will be reaching out to you this week and then making an announcement on Friday? Have you heard anything like that yet?
No, I haven't, but sometimes I get a meeting request within 2 hours or within 1 hour of the actual meeting time. So never say never, but so far I haven't received any.
Thank you, have a good day.
Thanks.
Any additional questions from CTV?
No, thank you.
CBC?
Yes, I did have one more question. Dr. Ahmed, I appreciate your focus is public health and the medical side of the pandemic, so I'm not sure if you can answer the question I'm about to ask. But given that the city just passed its budget, I'm curious about the financial impact that COVID-19 has had on the health unit. Are there any estimates of how much COVID-19 has cost the health unit either last year or for this year coming?
Great question. I would probably defer it to Teresa. She would be here tomorrow, and she can talk about the finances. Obviously, it has cost quite a lot to the an added additional cost to the health unit. We are scheduled to present our budget to our board at our next board meeting. So there are a number of that implication and that work has been happening, and but I'll defer it to Teresa when she returns to respond to this question.
Okay, thank you very much.
Any additional questions from Blackburn?
No, thank you.
Thank you, everyone. Have a great day.
Thank you.